and I'm gonna click start. Okay, over to you, Shikupe.
Okay, we'll just wait for colleagues to log, give them maybe another minute or two. All right, I think we'll begin the webinar. Good morning, good afternoon, good evening. Welcome, everybody. We're really excited today to welcome everyone to this exciting and really important webinar on quality matters for childcare, and to really understand what we mean by quality. We have an exciting series of speakers lined up. My name is Shakufe Zanji. I'm the Global Technical Lead with the Early Childhood Development Action Network. Before we get started, just a few housekeeping things. One, if you can introduce yourself, let us know where you're calling in from today, what your interest is in childcare, that would be wonderful. Please make sure you select everyone in the chat and not just hosts and panelists so that everyone can see you. Secondly, as the panelists are presenting and speaking, we encourage you to put in the Q&A, any questions you have on a rolling basis. I encourage the panelists to monitor the Q&A as well. Maybe they may be targeted questions just for you that you can answer right away, so that we try to get as many answers as possible. So with that, I'm excited today to begin this webinar. I'm just going to briefly share my screen. Here we go. Just to sort of set the context for why we're here today and why quality matters. So in recent years, especially since COVID-19, the world's attention really came to the incredible importance of childcare, which means access to any kind of facility for children while parents are working or unavailable to take care of their children. Although there is a broader definition to it. But this has become an interest of many different sectors. It's the interest of colleagues like us from the early childhood development sector, from education, gender equity and feminist groups and women's economics rights, labor and worker rights, social protection, health and nutrition. So a whole range and diverse group of people are really interested in ensuring that for many different reasons, not always the same reason, that we have childcare. But what the early childhood community brings to the agenda, so we know from all these different groups, all the different benefits that are there for children, for parents and caregivers, especially women, as well as for society overall in terms of economic growth, less crime, reduced gender and social disparity, et cetera, et cetera. But today we want to bring to the table the piece of it that the child development community, the people who care about the children piece bring to the table, which is on what is needed for early childhood development. And that's where quality comes into play. So we all know here that, the early years, especially the first 1,000 years, the brain development begins from conception. It's a really unique period of brain development, and it's really sensitive to changes in those early years compared to in the later years. The first 1,000 days of life, it's critical for lifelong development, where the physical structures are laid down, functionality develops. And what's unique about this period is that it's highly responsive to the environment. So the caregiving environment, most specifically. We know about the evidence on the long-term impact of these early years. So depending on what type of exposure in the early years you have, we know the impact on childhood and adolescence development features like high cognition, performance in schooling, emotional adjustment in adulthood, things like cardiovascular health, mental health, access to economic opportunities, etc. And it's a unique period in the life course in the sense that it only happens once. It's only built once during these first 1,000 days. And it's a period of extreme rapid learning that realizes all the basic structures and functions. And it's very responsive to the caregiving environment. And that's the crux of quality that we have. So we have so much knowledge in the early childhood field around what it takes to ensure adequate young children's development. But what disrupts that critical relational context, and there's so many reasons for it, from violence, poverty, migration, war. We have a huge number of reasons that can be disruptive to that relational context. But what can mitigate that situation, and which is why, again, we're here today, is access to affordable, high quality, flexible, and responsive childcare services for children when caregivers are unable to care for them, and ensuring that when children are with families at home, that they have access to caregiving and parent support that creates a nurturing home environment as well. So it's two sides of the coin to ensure that child development. So that's the lens that we are bringing in today. And it goes without saying, the need is enormous. We have over 40% of the world's children do not have access to childcare services, 250 million children, and now it's probably a higher figure under the age of 5 at risk of not reaching the developmental potential. 70% of 10-year-old children, low middle income, cannot read a simple line of text. That really goes to the quality piece. And a huge number of women would be able to access the workforce if simply they had access to childcare. So this is why we're here today. And I'm so excited to introduce our first speaker, who's actually herself a provider, a service provider. So if I can have Catherine Opio, who's with us today. She's supported by Nurture First in the Kisumu County, and she's currently one of the providers. And I would like to provide her the opportunity to introduce herself, but also share a bit of reflection from her experience as well. So Catherine, if you want to unmute yourself. And Catherine, I'm interested, as a home-based childcare provider yourself, first we'd love to have you introduce yourself, but also to understand what interested you about being a care provider, and why are you doing this? Would love to hear from you.
Okay, thank you. In Kenya, it's almost 4 o'clock, and we say good evening.
Good evening.
Okay, happy to see you. I'm called Catherine Opio, and I live in Kisumu, and I work as a home-based caregiver in Kisumu County. And the interest I got in this career, it was through an experience I got from a neighbor. That was when I was still young. I just finished school, and one of the neighbors was neglecting a child. This baby was around 1 year old, and the child didn't have someone to take care of her, to give her that love that was needed. So one of the neighbors took the responsibility and took the custody of the child. And the child grew in her arms, until the time the child was able to support herself. And currently, the child is working as a lawyer somewhere. And that was the time the parents came back. They wanted their girl back. But something funny, the child refused and said that the only parent that she knew was the guardian who took care of her. So from there, I changed my career and got interest in working with young children to give them that support. And
Catherine, do you,
also,
yeah, go ahead.
You have any questions?
Also, no, go ahead.
Okay.
Go ahead, continue.
Okay, thank you. That's the most interest I got in it, and I enjoyed it.
So,
It's
Catherine,
a passion.
do you have a care center in your own home?
Yes, I have a care in my house. Yeah.
And how many children do you look after?
There are around five children, ages between 6 months and 2 years. And yes, I love them. I work with them. Being
And
a second mother to them.
how many hours a day are they with you?
Mostly it's around 12 hours.
12 hours. From what time to what time?
Yeah, from 6.
6 in the morning?
6, yeah.
Until 6 p.m.?
Until 6 p.m. Some even go to an extent of spending in my house.
And why is that?
Because of the profession their parents are taking, and they have no one else to take care of their babies.
And so, Catherine, in your role as the care provider to these children in your home, what are some of the things you find most challenging about taking care of these 5 children? What do you find most challenging?
The most challenges I go through, one of them is financial support. Mostly the children I'm handling at the moment, their parents are not able to provide enough. And this also affects me as a provider because this child needs all the basic needs. And you find, especially with the feeding program, the child cannot get the full balanced diet that is needed. So I get it as a major challenge as a provider. And another challenge I get are learning materials. I don't believe a child will just come in my arms and just sit like that the whole day. This child needs to learn a lot. And some of the materials, learning materials, I can't get. It forced me at times to improvise even from the used cartons, sacks, and other things, at least for the learning to go through. And also you find even I receive a baby of around 6, 7 months. This baby needs a baby walker. And how can I provide a baby walker if the parents' pocket are not enough, are not giving enough? Those are the major challenges we get, yes.
So, Catherine, before you started your own care program, did you get any training from anyone?
Okay, I got training in as an early childhood giver. I worked as a teacher. Yes, but I got a lot of interest.
So you were working as an ECD teacher before.
Yes, yeah.
Okay, and then you started your own.
I started my own.
So I'm wondering, Catherine, from your point of view, what would be your key sort of requests or demands or asks to your government and policymakers? How can the government support you in your effort better? You already mentioned a few in terms of learning materials, access to financial resources. I'm wondering if there's anything else, any other message you want to convey.
And also, we need to get the knowledge on development mileage. And also, if we could get knowledge on first aid, because you find at times you receive a child with, yeah, you find the times in my daily basis, at times you get a child who is sick, maybe the child convulses in your arms, and you don't have any knowledge on first aid. It's very challenging, yes. And also, I will.
Yeah, go ahead.
Okay, with the government, I would humbly request if the government could give give us support on nurturing care, and also give us training on early childhood development. That would help us a lot, because these babies are our future leaders.
That's amazing. Catherine, what is the name of your care facility? Does your care, do you have a name for it? What is the name of your care service?
The name, Catherine.
Yeah.
Yes.
And what is it?
Catherine Home-Based Care.
Catherine Home-Based Care. And Catherine, my last question to you is, how does your family and your community see you? When they think of your job as a care provider, what is their perception? Do they think it's a good job, a bad job? Do they think it's a real job? What is your sense? Are you supported in your family and community in doing this profession? How do people view care providers in your community?
Okay, in my community, they always call me Mama Watoto. I'm a mother to babies. And also they recognize me because of that, because when they come across a mother who is stranded and needs some help, who can take care of the baby, they always refer those young mothers to me. And there are times I even receive these young mothers who may be dropped out of school and they need to go back to school. So you find them, they always direct these young girls to me to help them at least look after the baby while they go back to school and learn. Yeah.
So you're an important figure in the community, Catherine. Wonderful.
Yes.
I know we're over time and we are already having questions for you in the chat. So Catherine, I encourage you, if it's possible, to respond to some of them. And I hope you stay with us so that you can come back during the panel discussion as well. Yes. Thank you so much, Catherine, for sharing your experience and your expertise with us today. And it's a great way to start off our webinar today.
Thank you.
Asante sana, thank you. With that, Catherine, thank you so much again. I don't think there's a better way to kick off the next presentation. So I'm going to invite Melissa Kelly and Fran Beaton-Day, who are members of the World Bank's Invest in Childcare team. Fran is the co-lead of the initiative, which works to ensure more and better quality investments in childcare, and Melissa leads capacity building for the early learning partnerships. And today they're here to share the World Bank's experience in terms of what the essential elements of quality are as we move forward. So over to you, Melissa and Fran.
Thanks so much. It's a pleasure to be here with you all. So we're just going to talk quickly about some of the framing around quality and how we're thinking about it within the World Bank, and then move on to talk about some of the essential elements of quality that we believe are needed across childcare settings. So I won't go into this first slide in too much detail, given the excellent introductory presentation, but just quickly to mention why childcare matters. So of course, as was mentioned previously, to keep children safe from both physical and psychological harm, including neglect and emotional risks. And within childcare settings, the risks for younger children are obviously much higher given their vulnerability and the difficulty communicating. And there's also a significant amount of small-scale and fragmented provision, which is often unregistered, and that further elevates these risks as well. Good quality provision can be linked, of course, with a range of very positive child development outcomes. And the reverse is also true. So low quality settings can lead to no benefit or have very much detrimental impacts. And then finally, parents and guardians are much more likely to use childcare services that are trusted and perceived to support quality care. And this, of course, helps to realise the objectives around supporting increased economic activity and for parents to be more productive. Next slide, please. So some of the challenges that we hear in terms of quality childcare services, and this is from kind of country programs across the World Bank's portfolio, but also speaking to providers. One of the things that's highlighted is that quality standards are often lacking or inadequate. So in most low and middle income countries, there are not quality standards that cover all types of childcare provision. The standards may be very unrealistic and not reflect the variety of contexts and resources, particularly taking into account low resource settings and home-based settings. And they may also only focus on structural elements, which are easier to monitor. The unrealistic standards can really deter providers from registering, and there are high levels of unregulated provision in many countries. And there's also limited support for providers to meet quality standards and to improve their practice and their settings. So including unclear regulation or very complicated processes to navigate, having difficulty accessing training programs, limited financing available to make some of these more structural quality improvements, and poor monitoring mechanisms and opportunities for feedback and coaching to improve the practice. Next slide, please. So one of the things we've been doing is trying to define the essential elements of quality. And this is going to be the focus of the presentation today. What are the essential elements of quality that need to be in place at the settings level? And we've been trying to define the basic elements of quality, focusing on the most critical elements that are necessary and possible across various types of settings. And it's really about trying to get the balance between being comprehensive enough, but also flexible and feasible enough to take into account a variety of contexts and providers, especially the resource settings and home-based settings. We've been through a process which has included initial literature review, a review of quality standards from a variety of countries, and then quite an extensive process of internal and external feedback from international experts and providers at country level. And I'm going to pass over to my colleague Melissa in just a second to take you through some of those elements of quality that we believe are most critical. And just to quickly highlight, as I said, this is focused on quality at the settings level. In the next session, this is kind of part one of a two-part webinar series, we'll be looking at systems level quality. So what needs to be in place at the systems level to support settings to achieve quality. And it includes having a robust quality assurance systems in place, as well as policies and frameworks around practitioner training and ensuring decent terms and conditions of employment support decent work. Over to you, Melissa. Thank you.
Thank you, Fran. And as Fran said, today's session will focus on quality at the settings level. And there are two main elements of quality: structural quality and process quality. And on the left, structural quality includes the physical environment and program characteristics, while process quality focuses on children's experiences and the interactions with childcare practitioners. And as we've just heard from Catherine, that's why it's so important, such a critical role of the capabilities of childcare practitioners. In the center, you will see a scale, kind of the seesaw, to show that each depends on each other. And in order to have positive child outcomes and keep children safe, these two elements of quality are working together to ensure the components of nurturing care. As Fran said, structural quality is necessary and lays strong foundations, but we know in many countries the focus is more on structural quality, which is insufficient for ensuring positive child outcomes. So here are some of the essential elements that we've put together, and this is just a summary because there will be a guidance note forthcoming which will provide a more detailed and fuller list on the essential elements of quality. And many people on the call today have helped us to provide feedback into these. So the first is that the physical environment should be safe, stimulating, and structurally conducive to children's development. So that means an environment free of hazards, that's safe with ventilation, light, and physically accessible exits, that there's adequate space, a minimum of 1 square meter per child, and the outdoor space is highly desirable, but we know that is not possible in all contexts. In terms of furniture, this can be mats or small tables that children can rotate through activities, age-appropriate toilet and hand washing facilities, and culturally appropriate and bright decorations on the walls. Program characteristics should be able to meet children's basic needs, including nutritious and age-appropriate food and a manageable ratio of adults to children. This can vary quite a lot across countries, but we know we need more support, as Catherine said, for babies and young children, a minimum of 3 to 9 children for every adult. And as children get older, we can adjust the ratio to 10 to 15 children for every 1 adult. There should be a variety of materials for children to explore and build skills. And again, this can be locally available and natural materials such as shells, leaves, plush toys from recycled clothes, recycled food containers, as Catherine said. Structural quality does not have to mean expensive structures, equipments, and materials. And lastly, the workforce, which I think can be several sessions just on its own. Practitioners need to be have appropriate training and support to meet children's needs and be fairly compensated. And this includes training on child development, health, hygiene, nutrition, protection of a minimum of 2 to 8 weeks, along with ongoing support and professional development. So when we look at process quality, which is what happens in the setting, first we have activities and pedagogy. So having these elements that support child development through play-based and age-appropriate activities in a language that children speak at home. Second, health, hygiene, nutrition, protection, and well-being includes good practices around these areas, but also a way to respond to child protection concerns, being trained on what to do for emergency situations. And third, the interactions, the positive and responsive relationships with children, and really understanding what children need at different ages, but also this regular engagement with parents in the community so that they understand children's progress and can engage in material workshops or other ways to support the childcare setting. So what does this look like in low resource settings? I'll give you 3 examples, and you're probably very familiar with at least 2 of them. The first example is from Kidogo in Kenya. The Kidogo model recruits, trains, and provides quality assurance to women, known as mamapreneurs, to run successful micro businesses. So I know it's small, but if you look at the picture, we can see that children are in the setting with materials. They have their choice of materials. They're colorful. We can see recycled yogurt containers and a mix of different materials. They're in a clean, the floor is clean. There's a rug so children can walk and crawl. And you can see 2 mamapreneurs on the ground seated with children and supporting them to engage in these activities. The next example is from Zanzibar, and it's a community radio program where children gather in a community setting outdoors several times per week. There's a trained facilitator who is guided by the boombox, the radio that you can see there, on interactive songs, games, and learning activities. And so if we look at the picture, we can see that children are seated in a U so that they can interact with each other. They're seated on a mat, and each child has a slate string, and sticks or shells for math and counting activities. And the last activity is from BRAC. It's from Bangladesh, but I know that the BRAC Play Labs are also in East Africa as well. So we can see, well, first, I guess, the Play Labs, for those that who don't know, the Play Labs are community play leaders who are selected from the community and trained. They receive regular in-service training and coaching, and the community is heavily involved in supporting the materials and the construction of the center. So when we look at the picture, we can see that the childcare practitioner is smiling, she's hugging the children, engaging them in a song. The physical space is using rugs and colorful materials, and especially if you look at the back, you can see the lattice so that there's nice ventilation and airflow. And we'll be sharing these slides with you. Over to you, Shakafi. Shakafi, can you hear me?
Yes.
Okay.
Sorry, my computer just froze for a second. Thanks, Melissa. All right. With that, I'm going to invite our three panelists to come on. We have Smart Start, Nurture First, Mobile Creches. Wonderful. So I'm going to just introduce each of them. From Smart Start, we have Justin Jowell. She's the program design lead for Smart Start and a South African early learning, which is a South African early learning social franchise, which I hope we'll hear more about from her. We have Chirashri Ghosh. She's the executive director for policy and partnership at Mobile Creches. Welcome, Chirashri. And then we have Jessica Fullerton. She's the Chief Operations Officer at Nurture First and a Managing Director at the Global Development Incubator, the organization that is hosting Nurture First. All right. Well, welcome to all three of you. To kick off, I think I want to start with mobile creches. Maybe we'll start with Chirashri and then we'll go to Justine and then we'll go to Nurture First. So Chirashri, can you introduce our audience a bit to the mobile creches model and what is your philosophy and approach to quality? And also, frankly, would be nice to have, even if it's a brief reflection to the presentation shared by the bank right now as well. Go ahead, Chirashri. You're on mute, Chirashri.
First of all, I would like to thank the organizers, Agden, World Bank, and the viewers also to actually talk about the childcare thing. Mobile Creches started its childcare journey long before, 55 years ago. And it was when it started its journey, the model was an immediate response to the problem. But over the years, it has evolved its model, and it's now we categorize our model into three category. One is the direct demonstrative model, where mobile creches directly work at different settings, be it a construction site, brick kiln, tea garden, employer run models. Second is the CSO run models, where we actually train the CSO's partner to run those childcare models. And third is the whole, now we are more emphasis into the government run models, where government take the ownership and we are as a technical partner with the government to roll out the childcare model at the larger scale. If we talk about our direct demonstrative model, our model is a 6-day a week. It is open and it is a 8 hours program. In that we have a integrated program. In the first is the nutrition, where we provide 3 meals 2 hot cook and 1 snack. Second is the health services, where we have doctor visit twice a month, where doctor comes and actually see the children, they are all well or not, and if it is required, they also refer to the nearby hospitals. We also facilitate immunization, and we do the growth monitoring to see the impact of our program. Third is our whole ECCE component, which is a very, what earlier speaker was talking about. It is a very well child development principle curriculum, which is low cost TLMs are prepared, and through our trained childcare workers, it is transacted. Our training is in one of an important component where the women from the community, with the most marginalized community, we train the women, and we have a 36 days training, in service training and the pre-service training, which is first 12 days we have a pre-service training, and there is 24 days in service on job training. And in that training we handhold the whole childcare workers so that they are doing a very quality childcare transactions with the children. And fourth, our component is the whole community engagement part, where we engage with the parents, we engage with the community, and we engage with the local leaders so that they prioritize the issue. Parents, mostly we have an parents development program where we engage with the parents, that how they see at home, at the home environment, how they can see the change within their child, and also participate in the whole process. With the community, we see that how they prioritize the agenda and the demand for those services. With the local leaders in few of the states, we have experimented where we have unlocked the local fund for the ECD things, and they have invested 5 to 7% of the fund on the ECD childcare services. So this is a whole comprehensive structure. With that component, we run the childcare services in our different settings. If you say the quality standards, what are the quality standards we adhere to, which is the adult child ratio. In our Indian context, what mobile creches is adhere within, if the child is under for under 3 children, we have 10 children, there is 1 worker, 1 helper. For 3 to 6, for 25 children, there is 1 worker and 1 helper. So if it is a mix of 3 and 6, we have 2 workers and 1 helper. And there is an in charge who look after the administrative and data recording part. We have a robust MIS system where we track each and every children's health and nutritional outcomes, and also feedback to our program so that we can improve with those lesson learned, and also help us to design our program in a best way.
And Shirashri, do you have range of quality standards, like things that are absolutely non-negotiable and things that, if it's possible?
Yeah.
So how does that get enforced?
The range is, 1 is the adult child ratio, second is the curriculum, third is the whole training of the workers, fourth is the safety protocols, fifth is the whole trained supervisory team, because we always believe if only the child, we are dependent on the child care workers, they need hand-holding time to time. So there has to be a supervisor cadre who can help to ensure the quality benchmarking. So these are, space is another, child-friendly space is another quality standards which we follow, because without that space, we don't open the childcare centers.
And Shirashri, in the Indian context, are there national standards for childcare?
Yeah.
Is there a big difference between yours, or are they the same?
It is the same, but when we see the government running the childcare centers, the quality is compromised because the costing for the each child is very less, which our costing comes around $1 a day, and their costing is not even half a dollar a day. So it is a huge, it is a 3 times more our is the childcare investment, but the government is not investing on the childcare model there.
Okay, thanks, Chirashi. Let's move to South Africa. Justine, same question for you. If you can share a bit about the Smart Start approach and the quality work that you guys do, or your quality framing for Smart Start.
Great. I prepared some slides, so hopefully that's fine, mostly because I talk too fast or too much, so it's to guide me. So I always like to say a lot, so I hopefully will get through everything in the process, but a lot to share. And yeah, it's wonderful hearing both from Catherine and stories of mobile crash. So yeah, wonderful. So looking forward to hear more from the panel. But Smart Start is a South African social franchise. Our vision is to achieve population level change and access to quality and affordable early learning. Like for many of the countries here, many of our children do not access early learning opportunities, and we focus particularly on 3 and 4 year olds. In the 9 years since we started, we've trained over 18,000 early learning practitioners to start up their own programs. We implement our programs in partnership actually with other NGOs across the country so that we have sort of local reach. We currently have just over 10,000 what we call franchisees, Smart Starters, and they're reaching over 90,000 children in South Africa. I won't go into this, but just to say we really see the challenge as twofold. One is the capacity for the system to deliver. So the supply of what, in our case, venues and practitioners, and then also the ensuring that there's program quality, which is why this webinar is so important for us, and often we know that's compromised in poor settings. So how do we ensure quality? So our program goal is to ensure that all children have the age-appropriate social, emotional learning and language skills by the time that they start school. And when we think about quality in our program, I loved your presentation, Fran, because it talks to so much of what we're talking about here, but that there's resources and tools that need to be in place. There's program content, and importantly there, we really focus on the caregiver practices as well as structured routines. And then there's the structural features. So kind of grouping what you did in the two on that, what do you call it, seesaw, but basically looking at things like minimum dosage, maximum adult-child ratios, healthy environments, parental involvement, and so on. We then use all of that to say, well, what are some of the evidence-based practices when we talk about those caregiver practices? And we say in each of our programs, we have these 5 pillars, which is nurture, and we think is one of the most important. Talk, so lots of positive and plentiful adult-child interactions. Play, and what we mean here is opportunities for child-directed open-ended play that the adults then participate in and support. So if you go to any of our sites, you will see practitioners on the floor generally with children, like that picture of Kidogo that you shared. And then the story sharing, which is really interactive story sharing with children. And then that is all underpinned by a partnership with parents. So we encourage all our Smart Starters to build these strong relationships with parents. And what we know is that studies have shown that positive child outcomes depend on the presence of these components of quality, but rather than on the program type or venue. And that's really important for us because we're focused on setting up programs in home and community-based settings, not in what's seen as traditional ECD centers, very high resource places. So much like many people on this call, and why we feel invested in this process. And so we do work with a few ECD centers, but largely the majority of our programs are home-based childminders, part-time play groups that happen in informal settings like clinics and communities, as well as our program can be implemented in mobile settings, and we don't have many of those. I'll slow down now because I want to focus on the quality. But really what we do to ensure quality is that we firstly have a very clear and careful selection criteria. So we run an interactive assessment workshop and only select those who meet our initial criteria. We then go through a training and assessment process, and we try to ensure that our training is simple and accessible and helps women set up their first early learning programs. That then is supported by an implementable daily program. So our resources are simple. It offers a daily routine supported by a set of activities. And that daily routine is really meant to just give structure to the day. And then that in turn is supported by coaching and in-field peer support. And that coaching is both from field workers, but we also organize our practitioners into clubs, and that is self-driven support network. So we don't involve ourselves in those. That's peer support and community of practice around how they run their programs. Sorry, I just went too fast there. So just to say that some of the quality standards are maintained by our licensing system. So our field workers have a set of license standards that they go through. There's an initial one at their very first training. They get their first level of license. They then have a health and safety assessment of their site, which is the next set of standards. There's then a practice license, which assesses quality. And importantly here, the first two you have to achieve or you're out of the system. The third one, I'll explain it a bit more, but it's a robot-based system. So those that are red need urgent support and follow-up. Those that are orange, we continue with coaching and support until they can meet the practice standards. And those that are green, what we then call them fully licensed practitioners, and they would then only fall into the category 4, which is we revisit them once a year to check their licenses and standards. And that you can sort of see here, again, it's articulated in that it's such an important part of our model is that firstly, this club support, that all Smart Stars are members of a club, and that also our coaches, our field workers are then trained to support them locally. And the coaches use what we call this program quality assurance tool, which scores and rates the practice in those centers, thereby putting them in a red, orange, or green category. This is the journey of our Smart Starters, which I've sort of covered, and I'm speaking here, where they start with recruitment, they then go to training, they get a starter license, they get a smart space certificate, that's the health and safety one, they form a club, they get their full practice license, and then they get annually redone. And that just sort of highlights what the purpose of those are in each of that. Finally, just to say, just does it work? I just want to be clear, you can have standards, but does it work? We did two child outcomes evaluations, just completed the second one now. And in our first one, we showed that the proportion of the children achieving the standard in our South African early learning outcome-based measures at the start of the program were 32% of the children were achieving the standard for their age. By the end of 8 months, so it wasn't a full year, 62% of these children were now achieving the standard. So we were, and even those who were in the orange and red categories had moved. So we were really relieved and strengthened and encouraged by those results. We were then, you asked the question, what are some of the challenges that are facing childcare providers? And much of what Catherine mentioned, we had already put here in what we've experienced. But is that firstly, the access to suitable safe venues with enough space for children to play freely, because particularly in urban settings with very compressed spaces, often safe space for gross motor skill and for children to play is difficult. There's often the challenge or lack of financial support, either that parents are unable to pay sufficiently or government is not paying. And therefore, sometimes there's a push to increase the numbers of children in a program, and therefore less ideal child practitioner ratios, which obviously compromises quality. In South Africa, we have an issue that government doesn't really recognize home-based early learning provision. The current norms and standards are sort of unachievable and inappropriate, as Melissa was mentioning, and therefore they struggle to get registered, and therefore they operate in an unregulated environment. There's poor understanding of the value of early learning for many people. It's like learning happens at school, way to then, it's not necessarily important. And then also what Catherine mentioned, the lack of resources is a challenge. Some of the things we try to do to mitigate that is around venue challenges. We create simple plans and achievable standards for quality in home settings. We adjust the norms and standards to fit the context. So, for example, you don't need to have 2 child-sized toilets. How do you have safe and hygienic practices with the potties? Then the licensing one is about how we support sort of the coaching process. So we're doing the red, orange, and green to give graduated support that visibly shows quality to parents and communities. We provide resources and guides on how to make and find affordable resources, as well as group together with other organizations to look at large-scale interventions that enable the costs to come down for books and so on. We know that there's financial pressure to take on too many children, so we work a lot with our practitioners on strengthening their costing, their budgeting, how to save costs in their peers, how to look at microfinancing and so on. And then the building of the value of early learning in the community through communication, through showing imagery of what quality programs look like and what that can be for for children and the value for children. We believe very strongly that we invest a lot of time and energy in elevating the stories of people like Catherine. So that's mine. Hopefully not too long.
Amazing. Thanks, Justine, for that. Since Jessica also has a presentation, that's a good transition actually to go to Jessica, where Jessica, with the Nurture First work, really focusing on home-based childcare settings. And I find often quality standards in a home-based context is much more complex and requires a nuanced understanding than center-based, where you have a dedicated space, dedicated time for that. And I think that's like a crux of our challenge right now, that we do have a proliferation of home-based services that are filling sort of the market gap that's there. And so how do we navigate that? So curious about Nurture First insights. So over to you, Jessica.
Great. Well, like Justine, I have a presentation. It's just going to be 4 slides, so I'll go through it quickly. Let me know when you can see it. Okay. Great, thank you. Okay. So Nurture First is focused on home-based care settings. Justine referenced home-based care settings in her presentation as well, of course. The way that Nurture First defines home-based care is that it's childcare that's given to groups of children by a caregiver in that caregiver's dwelling. It's often considered a community service. So Catherine Opio, for example, is one of the home-based care providers that we are working with now. Nurture First is focused on this setting because the majority of the world's children are cared for in these kinds of settings. And actually, as the slide notes, children in lower and middle income countries are 3 times more likely to be supervised in home-based care environments than in formal daycares. These are really organically scaled channels for childcare deliveries. In international development, we often focus on how do you scale something. And here we have organically scaled methods of childcare that we can work with. But at the same time, these settings are often blind spots for both national and global policymakers and funders. And so we're really working to change that, to bring awareness, to bring new funding and new policies and new practices to this space. Nurture First, as the slide states, is working towards a world in which all children, particularly in the first 3 years of life is the age group we're looking at, have the care that they need to thrive, that families have access to affordable and childcare options that can enable them to work, particularly women, and that childcare providers are adequately compensated and supported for their work. We work at the systems level. And so we are trying to work across policy and practice to support home-based care providers in all of the ecosystems in which they're in. And we work both at the global level, I'm a member of the global team, and at the country level. And we've started in the last 18 months in Kenya. And I want to talk specifically about how we're thinking about defining quality collaboratively with providers and families and government, starting in Mombasa County. But our model more generally at the country level is to provide technical assistance to governments and local community-based organizations to help them understand the needs of providers and recognize providers as public servants. We fund and train staff who we embed in community-based organizations to support home-based care provision. And we work collaboratively with local government officials and local community-based organizations and families and providers to design what we're calling learning interventions or pilots around particular areas that home-based care providers need support in. And I'll talk about that in a moment. I'm so excited to be involved in this conversation on quality because I think it's so important. We really believe that quality childcare is a human right and that all children, regardless of the types of care settings they're in, deserve the same opportunities for support, for learning, for development. And so we believe when it comes to quality that there should be some baseline standards that are uniform across different settings. But we also need to understand what are those nuances between the settings so that they're appropriate. We are an evidence-based organization, so we believe that these standards should be informed by evidence and that they shouldn't be static, that they should be regularly reviewed and updated with research as it comes out. and vitally that these standards need to be contextually relevant and informed by providers and families' lived experiences and perspectives. So I'm going to talk quickly about how are we defining quality in Kenya. And I think the sort of paramount approach that we're taking is one of collaboration, where we're really trying to elevate, as we do in all things, providers' voices and community voices in driving how quality is defined. So we have a technical working group in Mombasa County that we have supported setting up. It is a working group that is led by county governments in both the health and education ministries. It's also supported by Kidogo Early Years, who's a really important partner for us, and we're so glad to be working with them. We began our process of defining quality in the technical working group by inviting providers to help define the scope and the approach we were going to use to define quality standards. We brought technical working group members to providers' dwellings to see examples of how home-based care actually operates in practice. And then we reviewed 4 different sort of meta tool standards for quality care against the nurturing care framework. And that's what you can see on the right side in that graph, which was over 180 different indicators. We looked at existing standards from Kenya's Departments of Health and Education, Kidogo's standards, and also another research study tool. Then we held 5 stakeholder workshops with people from Mombasa County, some people from the national government, and tried to map all of these different indicators against some criteria here. And the criteria are in bold. So how will these kinds of quality indicators inform action towards quality improvement? Are they contextually appropriate in a home-based care setting? Will the attainment of this kind of indicator result in measurable outcomes for children? Are they easily applied and understood by the people who are providing them? Can they be objectively applied in a reasonable time frame? And are they aligned to relevant national and policy standards? Simultaneously, we are in the process right now of gathering data from providers across Mombasa, Kisumu, and Murang'a counties. And so far, we have about 5,000 providers that we have surveyed to try to understand what are their needs and their challenges and their preferences, which is really exciting. And we're eager to share what we learned from that data gathering exercise in July and August with those who are interested. And then this weekend, we have a provider and family focus group discussion where we'll be asking providers and families to look again at these quality standards. So we're down to about 50 quality standards we have now. We're trying to cull those further, but we have come down from 180 and we still have a ways to go. But I think this concept of how do you center quality in the voice of providers and families and make it really relevant for them is something we're working, very hard to do. You know, we've been asked to share what are some of the challenges that we see when it comes to quality for providers. I was a little bit sad we weren't asked also to share the strengths and successes because I think there are so many as well. And so I'm just going to focus on the challenges that we've heard now. What you see on the left side is some of quotations from enumerators who are currently collecting data for us from providers. And a lot of different challenges emerged, as you can imagine, when you're collecting data from 5,000 different people. We kind of grouped them into a couple of themes here that we're looking at. Of course, in a home-based care setting, there are inherent physical space and infrastructure constraints, right? Space is difficult. The materials that are in the floor, in the walls, in the roofs are not the same as there might be. Often the locations can be challenging. You know, we heard examples of these kinds of care practices being too close to the road, for example, shared compounds with other tenants, which can provide challenges. The second area that we have heard about is that there's sort of inconsistent access to great responsive caregiving practices. And so sometimes caregivers don't know how to kind of interact with with children in really responsive ways. Sometimes they just can't act in really responsive ways because they have 10 children that they're looking after. And that's really difficult to do. So that's a need too, is sort of supporting that element. And then often home-based care providers like Catherine are working with families who live in really low resource settings. And so children who are coming into these settings can be malnourished, they can suffer from poor hygiene and other areas. And so home-based care providers taking on so much to be able to be that second family home for these children. So what we're working at Nurture First to do to address some of these challenges is a number of initiatives. And the first is we really want home-based care providers to be recognized and not be working in the shadows, and enable them to access vital government and community-based organization resources. Often daycares have access to nutrition feeding programs, etc., but home-based care providers aren't registered and recognized, so they don't have the same access, and we'd like to change that. We're also looking at how do we develop quality improvement roadmaps, trainings, materials, etc., that home-based care providers can adopt based on the quality standards that we're defining that I just spoke about. And these quality roadmaps need to be really non-punitive. We don't want to scare people away. We want to kind of bring people in, help equip them, support them to deliver the quality care that we know they really want to. We're also working to support home-based care providers to organize and form networks so that they can increase their own representation and access to support services in the way that they want to. One of the things we've been working most on is the fourth bullet, working to shift government mindsets and policies to support home-based care providers. And we've seen a great shift there, both at the county government level and at the national government level. We've been working with NCCS, which is the National Child Coordinating Service in Kenya, and the Council of Governors are really interested in this topic now. We're working on enhancing nutrition through kitchen gardens programs, and trying to work on how
we can wrap up. We're just running way over time.
Okay, sure. Well, just to say, those are some of the things that Nurture First is working on. I'm happy to share more for those who are interested. Thanks so much.
Thanks, Jessica. I'm going to invite Fran and Melissa and Catherine to also join the panel, as we can have a bit of a joint discussion on some of the major themes that I've also been tracking in the questions as well. And then we can hear from a few audience members. Audience members who wish to speak, you can raise your hand, or I may call on you depending on some of your questions as well. Okay, so I'm going to request if all panelists stop answering questions, just because it's hard to track, because open questions go to answered and then it's hard to track that. So if people can just stop answering questions, that would be really helpful for this section. All right, so Catherine, are you able to join us as well? I don't know if you can or not. That's okay. All right. So thanks so much to all the panelists. Catherine, let me turn it over to you. Do you have, after hearing all the presentations from the different parts of the world and thinking about, you know, some of the issues that were raised, is there something you want to share? Is there a reflection that comes up for you? Is there something that you say, yes, this is also an issue for me? Is there something you want to share, Catherine?
First, I'm so grateful for the presentation, and I've learned that the same challenges that go through as a home-based is also the same that others were discussing from the group, yeah. And it is my prayer that all our requests will be met, and may God bless you so much.
Thank you, Catherine. Catherine, there was a good question for you in the chat that I want to ask you. And the question was, do you charge different fees for each of the different individuals, or do you have a standard fee? Or if people can't pay the fees, what do you do? What's the situation around payments, parents paying? Do you have a fixed monthly fee?
No, okay. With the charges, I charge differently because the parents I handle do not do the same. Their earnings are different. Some are very low income, and they struggle at least to get something. So my charges are different.
Okay.
Around $1 per child per day.
$1 per day.
Yeah.
Okay, so you charge on a daily basis. Do you charge on a daily basis or?
I charge on a daily basis.
Okay, so maybe today the parent has money, they give you money. Maybe tomorrow they don't have money, they don't give you money.
They don't give me money. So it forced
Okay.
me to go back to my pocket and provide for the child while the parent is away.
So I think this is a really important theme, and it's come up in a few questions, and I want to put this out to the panelists. You know, while we have all these quality standards, the reality is that so much of childcare operates outside of regulatory frameworks. And I just want to share, over the past year, a lot of our colleagues have been a part of this effort. That the global team, we've been working on a massive childcare systems map to really understand the complexities and the interconnections of the different aspects of childcare. And I want to just take our attention to one part of it that came up a lot, which is around market-based childcare and some of the quality, the resulting quality impacts. So as we've heard from some of them, as you have, you know, if there are no external, if funding primarily comes from fee provision, and you know the market is driven to fill that service provision gap, you know, the focus of profit and wanting to drive down costs, to drive up cost savings, resulting in higher ratios often, or challenges around quality. So I want to put that question to the group around this particular dynamic that exists, this tension between quality and cost. So open up to the floor for any insights. And then we had similar questions in the Q&A as well around the issues of cost barriers. And I'll just read it. For providers that are offering ECD service, for parents who are paying for the service seem to be a bottleneck on quality. Can you talk about experience of either supply side financial instruments, microloans, or demand side financial incentives like cash transfers or childcare vouchers, for example? But anyways, first the insight on, you know, nuances of your own experience around the cost, quality, and the market-driven service provision.
Shikuko,
Justine, you unmuted. Go ahead.
That just for a minute.
Okay. Yeah, go ahead, Fran.
Thank you. So I think this is a question that comes up, and it's a really interesting one. We hear this all the time. And I think there is a need to differentiate between maybe large for-profit providers, especially those backed by private equity, where there is a really serious and kind of tension between profits and quality. But a lot of the providers that we're talking about on the call today could be classified as for-profit non-state sector providers. And those are very small scale. They're trying to get fees as low as possible for families. They might be generating a small amount of profit or surplus, but it's not in any meaningful sense of the term. And it's certainly not with the kind of intention to be making a lot of money rather than reinvesting it back into the provision. So I think it's really important to bear in mind those two differences. And I think for those providers in the latter category who are trying to serve low-cost families, it is extremely difficult for them to get to a low enough price point that's affordable for families and enables those providers to meet quality. And that is the critical challenge. And that's where, if we're going to have a system in countries which relies in part on non-state sector providers, there does need to be government engagement and kind of in terms of both financing or other financing mechanisms to help these providers to be able to offer quality services at a price point or preferably free so that all parents can afford it. And I think that's where some of the, in part, in reference to your second question around sort of where are these sources of financing, there's lots of interesting models which are either supply side financing to providers, so subsidies, grants to help them to cover some of their operating costs, to help them to implement quality improvements or to kind of set up in a way that they've got kind of good quality provision in place. And those are really important. So that's the supply side aspect. And on the demand side, there's a similar thing around kind of allowances to families, various different forms of that, which again can help to enable families to afford services. It can help to mean that providers have a stable source of income so that they can actually invest in quality and kind of not have to worry about financial vulnerability. And I think the way those programs need to be structured, though, is very much with a focus on equity and on quality. So a lot of the risks around open market provision is that there are issues with both equity and not being able to reach low-income families, and poor quality. And I think there are a number of examples, and I can send some through, of governments where they do put kind of quality conditions attached, or they're targeting these sources of financing either through providers or families to reach low-income families or otherwise vulnerable families. So just a few kind of thoughts and reflections on that. But yeah,
Thanks, Fran. And often they also can increase access as well. Like, so sometimes it actually increases equity, even though
absolutely, and also
access, but not the quality. Yeah.
Also the diversity of services. I think the other thing with childcare is that families have such different needs and preferences, and actually sort of having diversity of service providers available, various forms of non-state sector provision can be quite helpful for that.
And Fran, to that point, the importance of choice and allowing families to have a choice. But Justine, you had your hand up. Go ahead, and then we'll go to Chirashri.
Yeah, Fran explained it.
Oh, sorry. Justine.
Sorry, Chirashri. Yeah.
Justine,
just to quickly add, I think Fran, you articulated well. I just wanted to caution around the articulated and around our assumption around markets. A market-based service, because in South Africa it's not a state-provided service. It is supposed to be subsidized by the state, but largely not, because programs can't, the smaller home-based programs can't access it through, because they can't access the norms and standards. And I think, what Catherine articulated so well is what we find on the ground with our practitioners, which is that they are offering the service often with a quite sophisticated, graduated way of means testing for their parents, and it's not just on a per family basis. It's also on the month and the day and this family, and how do they know this one has new shoes and therefore should charge them. So there's like a whole sophisticated place around how they set fees. But for most of our practitioners, they are either not breaking even or specifically drawing from their own pocket to pay for food, rent, and so on. And I think it's an unseen funding. When we look at how ECD is funded by the state, we're actually not seeing this massive funding that's happening by either parents or providers who are paying for a venue, often paying for food, keeping children well over time. And so I think how we articulate that for-profit idea, I think, is super important for our advocacy around actually this is a right, as articulated well in Nurture First, and how do we help support that. So some of the funding models we've been looking at is we partner with some of the government public works programs that are often quite menial work, but we offer for the same fee a more meaningful piece of work through offering early learning programs. We also look at partnering around voucher-based, subsidy-based work that we fundraise for, as well as a lot of work on advocating for government to change the norms and standards so that they can actually provide home-based providers with the same subsidies that they would provide to a preschool.
Thanks, Justine. Chirashri?
Yeah, I just want to echo what Justine was talking about, because I think childcare is in public goods. It is not, it should be the state responsibility to provide the services. There may be multiple models available in the market, but it is ultimately the state responsibility to provide the childcare services. And we believe that it is a state responsibility. The states have money for infrastructure, for defense thing, but they have to also put in money for the childcare. So unless they recognize that childcare is an investment for the country, it will not work. I think there may be people who can access with the whole low cost thing, but there are people from the margin, they can't pay for that. It has to be recognized by the state that it is a state responsibility.
Thank you. So now to Jessica, did you want to come in, or?
Yeah, I just very briefly wanted to say I couldn't agree more with Justine and Chirashri. I think that this is a fundamental right, and one of the things that we're doing is an affordability analysis, where we're looking at what are all of the costs associated with home-based care provision, and then trying to map different funding sources to them, because we know that the vast majority of home-based care providers in the settings we're operating are never going to be able to thrive on family funding alone. And so Yeah, so just to say agree, and it'd be great to work together on this because I think it's so important. Go ahead, Shikari.
Wonderful. I know we're behind on schedule, but there's some great questions, and I had some questions that has emerged from this conversation as well. So one of the interesting questions here is how there were different approaches to determining what those minimum quality standards ought to be. You know, and Jessica, you shared a very comprehensive participatory approach of looking at that, not just being driven by the evidence, but also looking at what that means. I wanted to come to one aspect that I think maybe Justine, you mentioned in your presentation, which I've seen before, is while we can work on the regulation side to put in these quality standards and determine them, and there are a lot of questions, there were a lot of questions in the Q&A. Are we missing, you know, what gets included, what doesn't get dropped? What about, you know, disability? What about gender? What about like culture sensitivity, climate? What about linkages to other services? What gets put into that minimum package? But the part that I find often, and this is why we did the systems mapping, because this is, you know, it's like these dynamics that are there. It's not just the government structural system, but the dynamics that exist within childcare. And that is parent perception of what quality is, that often drives that demand. And that is often not very aligned with what the child development people think is quality. You know, they want to be able to have their kid come home and recite the 5 poems or 5 whatever, or, you know, they want to see the nice plastic toys. I visited, you know, facilities here in Bangladesh where parents are proud that they can buy little packets of chips for their kids as snacks, you know, as a way of saying they're doing something good for their children. So just some reflections on that demand side of quality and how that shapes, you know, all our best efforts at implementing the structural quality elements. So I'd love some insights and reflections, especially from the implementers, like if you guys have any thoughts on that, on your own experiences with that. Justine, I feel like you're right about to say something. And
trying to be quick because I know
Catherine, this is a question for you as well, because you must face this in your work. So if you feel comfortable enough to share, we'd love to hear from you. Justine, go ahead.
Yeah, I mean, there's so many competing things there, but I think you articulated it really well. And the added addition in South Africa is that primary school is free. So the idea that you would pay anything in poor communities, primary school is free. So the fact that you pay anything for early learning is also a thing we have to work against. So I think, you know, the thing we've discovered best is like, how do we make those standards so minimal and replicable and visible to parents in some way? So it's people on the ground. It's
Oh, you're on mute, Justine.
Sorry, Justine, you're on mute for some reason. Justine, can you unmute yourself and repeat the last few sentences?
Sure. I was just going to say that, did you hear the challenge? I'm not sure if you heard the challenge about primary school education. Yeah. Oh, okay. So in South Africa, the ad,
people is free, so you have to convince people to pay. So that's yeah.
Totally. So what's been clear to us is, firstly, how do we make things as contextually simple and relevant as possible so that a parent can see it visibly, like someone on the floor, resources, in engaging, you know, song, nurturing, talking, story sharing. So we do quite a bit of trying to help provide the providers with little information, things they can share with parents. But we have to keep that as in a way, I don't want to say almost agnostic as possible, because the pressure, for example, in South Africa is that what you were saying about children counting, or we also have the pressure about English. Parents really want their children to come home speaking English. No matter how much you think that it's important for mother tongue instruction, that's not what the parent thinks. And so there has to be this sort of meeting. I really loved what you were saying, Jessica, about how Nurture First really is working on what does the quality mean for a parent. So we try to define it and support the practitioner to offer that, while at the same time being able to listen to the parent and meet them halfway. Because if we just said we're not doing English, we get so many parents who turn the other way. And then the last thing to say is what we've been working quite a lot on is parents advocating for it. Because once the parent experiences what happens for their child over time, they're the best advocate for it than anybody can do. So I think that's critical. The more we can create access to these kinds of quality spaces, the more the mindsets of parents change, and then they influence others.
Thanks, Justine. Shirashri, go ahead.
Yeah, I just want to add that when in Indian context, when we work within the most marginalized community, we have seen that the most important thing which they prefer for the qualities, one is the English, but when we are working with the poorest of poor, we see the nutrition is the one of the part which actually attract women to send their children there, because most of the women when we work in the construction site, they talk about that why you keep Sunday close the center, because I am not able to feed my child 3 times. At least 2 times you are feeding my child, and the third meal we are providing. So sometimes nutrition is also one of the area for the thing which actually attract parents to send their child, and then they slowly see that how nutrition is also been linked for the cognitive development. One, the child is healthy, they receive more. So I think in Indian context, when we work, nutrition is one of the component which we have seen that has really worked. And secondly, community engagement part, because most of the program doesn't have a well established community engagement part. Unless we are engaging with the whole community and think collectively that childcare is everybody's responsibility, it will not happen, and the demand generation will not happen. And we have seen when we have engaged with the community, with the local leaders, they started recognizing childcare as an important thing, and then they slowly understand the quality and other things.
And so I think in conclusion, you know, thinking about that parent-led demand side of things is a really important equation in terms of stabilizing the quality element. Catherine, I'm wondering, do you have any thoughts? You know, do parents tell you things that you feel like are a mismatch for how we understand quality? If you want to share, no pressure. Okay, so the final question that I'm going to put out to, oh, someone was speaking. Catherine, did you want to share your experience with this on quality, how parents and your community members think about quality?
Yes, parents want quality, but I cannot afford due to the low payment from the parents.
Oh, I think her internet is stalled. Maybe it's holding. Thank you, Catherine. The last question, moving on, I feel like a lot of this brings us to the next tension in the whole quality debate is around scaling. So, you know, with this advocacy around childcare and a push for governments to implement childcare, you know, access, it's what happened with primary school, you know, getting children, what was it, children in seats or whatever for primary education. You know, so the push to increase access versus slowing down, your access will be slowed down in a few in the early years of expansion for focusing on building on those quality systems, the quality infrastructure, doing all the socialization, getting all of that right. So just curious about you know, and I want to turn it to Melissa and Fran to begin on this question, because I know we have a part, and this is a good segue for, you know, a plug for the next part of the conversation, which is around the systemic parts, but really that tension between building out those quality infrastructures and things that take time to get right, take time to get mindsets right. You know, people don't automatically, I mean, you can have all the supervisors you want, but if they understand quality the way parents understand quality, well, we're now reinforcing those same standards regardless of all the tools that we have. So just wondering about your reflections on that whole like scaling and ensuring quality and yeah, just reflections on that, and then we'll go around and close it up.
Thanks, Shikufe. Yeah, I'll give some initial reflections, and then Melissa, please come in as well. But yeah, as you say, that kind of this is the critical tension, and sort of what we've been thinking about is how countries sort of work on medium and longer term efforts while prioritizing investments that can help to ensure kind of children safe and the quality provision is in place sort of in the short term and give kind of children what they need in terms of safety and stimulation. So we've been thinking about maybe three different things, and some of this we articulate in the guidance note, but so sort of prioritize trying to get in place a set of feasible standards and registration processes to encourage providers to register and bring them into the system, so that they can potentially access subsidies and additional supports, but they really need to be feasible and kind of starting at a very basic level, and countries have put in place sort of more progressive frameworks which can be helpful, so kind of more advanced, building to more advanced quality standards over time. Sort of an initial focus on making sure spaces are safe, which doesn't have to mean, as we said before, kind of expensive infrastructure, expensive materials. It can be just about kind of making sure that environments are clean and secure, and they have access to kind of low cost, locally made materials, so that they're safe and stimulating for children without kind of necessarily needing to be elaborate. And then over time can work towards much more pedagogically intentional spaces, and kind of more sophisticated, flexible spaces that support care and early learning. And then, of course, workforce capacity. So a lot of this sort of draws onto the systems piece that you mentioned next week as well, but really prioritizing improvements to workforce capacity to make sure that they are able to provide this nurturing and age-appropriate care and support children's safety and development, and getting in place some really critical short training opportunities, coaching opportunities, kind of site-based opportunities, while working longer term to try and professionalize the workforce and sort of formalize qualifications, and establish more attractive career pathways, and of course thinking about the kind of the decent work aspect and how you make sure that there are policies in place that protect childcare workers and promote sort of proper kind of living wages and access to social protections. So that's just some of the ways that we've been thinking about it, but very much welcome a conversation on this and some further thinking around what are the critical aspects and how to build over time.
Yeah, thanks, Fran. That's really helpful. Chirashri, over to you.
What we think about that when we talk about the scale, we can also look into what are the non-negotiable and what are the desirable norms. One, we can see that without minimum this, we will be not starting the childcare, and it can be a phased manner. We go for the desirable norms. So I think there should be a journey from non-negotiable to the desirable norms, and that if when we talk about the scale, because when we talk about the scale, some maximum time the qualities are compromised, and we have seen that. But once it is established slowly the quality also, then we talk about the whole decent working conditions, we talk about the nutrition quality, we talk about the health. So I think that first we should talk about the non-negotiable. With the phased manner, we should go for the desirable norms.
And I think, Justine, you at Smart Start kind of have that, right? You have your criteria for before anything can even go online. Is that right?
I'm not following the online piece. Shikufa, can say what you mean by that?
No, I was saying, I think at Smart Start in your presentation, you shared like particular criteria that need to be met.
Yeah, and I think what we've been trying to do is, everyone always says scaling is a minus or a subtraction game, and I think what's really hard for people who drawn to this work is that we do want to provide all. It is part of the lens with which we look at things, and I think it's been one of the hardest challenges in the scaling is trying to figure out what the simplest moments or things that you need to do, and almost, even though those are not sometimes challenging in different spaces, holding true to those. And then I think what you're talking about different moments in our journey is that for us, we also piece out our moments of more resource support over a journey, so that certain gates are met in quality, so that it's not all up front, but it's spread out over time, and that there's an achievement in each of those things, which I think has really worked for us in ensuring that people stay engaged, but also that we don't invest too much up front when we maybe need to spread those out rather.
And an aspect of this that we won't have time to unpack now, and actually, Chirashid, this is what I heard from your Mobile Crushes colleagues actually, is that when advocating with government for quality childcare, they kind of turn off because quality is this black box term. They don't know, like, oh, we don't want to engage with that. So that's another double-edged sword around quality. But you say expand childcare, have these many kids get into these classes. That's something that I think from a policy point of view can also get on board. But Jessica, giving you, and hopefully Catherine will have the last word, but just to close up the panel, for you, it's an interesting situation because in many ways, the home-based childcare is at some level of scale already, this, because it's a market proliferation. So in a way, what you're trying to do is scale quality, not scale access, because the access is there. Maybe you're working on some access, but I think what's interesting for you is like really what you're trying to help us figure out is how do you scale quality within existing infrastructure. So yeah, curious to have your insights.
That's right. I mean, I think, as I mentioned in the presentation, home-based childcare is organically scaled globally. And I think that's one of the strengths of this model. Our viewpoint is that to really improve quality, you've got to support providers. And that's what we're trying to focus on, is how do you lift up providers, make sure they have access to the right resources. I think, I was really, I appreciate Fran and Melissa's approach to what is structural quality and what is process quality. And I think it's easier in many cases to just focus on structural quality. But in fact, in the places where we're working, structural quality has inherent barriers. You have the dwellings that you have and you can't change those. But that doesn't mean that we can't focus on the process quality pieces in supporting interactions that are helping provide learning and cognitive development. And so I think just because we can't solve for all of these things doesn't mean we shouldn't really focus on the things we can solve. And I think that's a really exciting opportunity for us all to focus on.
And Jessica, just to add on to that, and that was the insight from the systems mapping working group that we did, was sometimes doing the thing that requires a lot of effort is doesn't always have to be the path we choose. We can use something that is a much lower effort that will actually create so it's really important to have that systemic perspective on these things. Justine, quick comment from you, and then Catherine.
So quick.
I just loved.
I love that organic flow. I just want to say in South Africa, part of our problem is we've got such a high unemployment rate that we don't have as strong pressure for childcare. So we're really having to also build this understanding of why it would be important to encourage early learning, because those don't organically always form. And it's sort of fascinating. But I love your thing about focusing on process rather than space. And but it's hard to break people's image of what quality looks like because they see it as a space and not as in terms of the process factors.
Yeah, absolutely. Well, thank you so much, colleagues. Catherine, I'm hoping, do you want to share anything with us as we all think about how we can support, people who are really doing the hard work? It's you 12 hours a day. I mean, here we are sitting on this webinar talking about quality, but really 12 hours a day with 5 children, you have your own life, your own family, your own community, to do that, 5, 6, 7 days a week. So really, we're all here in support of you and thousands and millions of women just like you, and who are providing, services to the most vulnerable children in the world. So please tell us what we need to do better.
Okay, I look forward to any support so that I can offer holistic childcare.
Thank you, Catherine. Thank you so much. Thank you for all the good work, and thank you to each of the panelists, and thank you to the World Bank for co-hosting this really important event, and we look forward to the next one. So thanks, everyone. Have a wonderful day, evening, wherever you are.
Thank you.